Hi everyone, this is Dr. Stefan. In this video, I'd like to discuss a little bit about a checklist or a couple of tips that you can use to get past one of these annoying coughs that can happen after a cold. So many people do have this residual cough, this ongoing cough after a cold that can last for a couple of weeks, and it doesn't seem to go as quickly as we would want. But sometimes it can be things that we're doing that are actually driving this cough. So, some of these tips may be helpful to you to just sort of get past this as quickly as possible. Now, just before I start, I'd like to just say that some people do have a cough that lasts for longer than 6 to 8 weeks. I think in that case, it's a good idea to probably see a health provider, talk to your doctor, see what that may be in case there's been a complication after that chest infection or cold that you had, just to make sure that everything's okay. And generally, if you're worried about your health, about your symptoms, always try to seek the appropriate medical advice wherever you are. So don't just rely on information you find on the internet because it may not apply in your case. Just like this video may not apply in your case. So try to use your own common sense. And I really strongly recommend that you go see your doctor every time you are struggling with any health problem. Now, that being said, the first thing I'd like to say is that sometimes when we have one of these ongoing coughs, it's important to just maintain the right amount of moisture and humidity at the level of the upper airway, so in your throat, your pharynx. So the first thing that you can try to do if your cough's not really going away, you've got this tickly, dry cough after a cold, is to try to use just some lozenge or chewing gum to just maintain saliva flow that will keep everything nice and moist to sort of soothe the upper airways. That can sometimes work. The other thing you can try to do is just to use honey. So just a normal bee honey, just to try to take a little bit of honey on a spoon, just and sort of eat that, and that sweetness will sometimes soothe the throat. So that can help as well. Light, sweet herbal teas can also help sometimes, like chamomile tea. That can also help a lot just by taking little sips. It can actually soothe your upper airways. So that can again help you get past these episodes of cough, because what can happen sometimes is that you're coughing, that irritates things a little bit more, and you want to just break that cycle that causes more irritation, because the cough itself, it's sort of a ongoing because you are coughing. It's a little bit of a vicious circle. So that can can help. The other thing is, if you've got a lot of like secretions built up at the back of your throat, you can't really cough them out. You can try to gargle some salty water and just spit that water out. That may also help a little bit. The other thing is, overall, you may want to keep hydrated quite well. So this is quite important. And you need to make sure that you're drinking enough water. I wouldn't suggest that you exaggerate, but just try to not be thirsty. If you're thirsty, you're probably a little bit dehydrated. So try to drink enough water during the day. If you don't like just plain water, maybe add some sort of a syrup in it, or have a tea or a soup or something like that, just to make sure that you're getting enough fluid. I'd like to just mention one important thing. A lot of people, when they drink coffee, they don't drink water afterwards. Now, coffee itself does dehydrate you. It's a little bit of a diuretic. It's just makes your body get rid of fluid. So if you're having a cup of coffee, it's quite important to just have another cup of water. So if you're having a very strong espresso, try to drink a glass of water after that. That will actually help maintain a nice level of hydration in your body. The other thing to consider, especially going into the winter holiday season when you're meeting other people, if you are going to drink alcohol a little bit more than usual, be mindful that can dehydrate you as well. So if you're drinking 4 beers, for example, be mindful that the beer itself does act as a smallest mild diuretic. So you may actually feel a bit dehydrated after drinking 2 liters of beer. So just be mindful not to drink too much if you are having this issue with an ongoing cough after a cold or a chest infection, because it might actually help you recover a little bit better. So that's another thing that you might want to consider. The other thing is dry air. So obviously, if you're living in a cold place in the world, so I'm in Europe, so in winter we need to turn up the heating, otherwise it would be very, very cold. So inside, because of the radiators just pumping heat all the time, the air gets a little bit dry. So you may wake up in the morning with very dry airways. So just to prevent that, it's important to try to keep an adequate level of moisture in your house. You can do that by using a moist towel or cloth that you put on your radiator overnight, so that can sort of evaporate overnight. You can also try to use a little tray or a little bowl with water that you leave on the radiator, and that can actually help to improve the moisture in your levels in your house. Now, you don't want to exaggerate with this. You don't want to be at a level of moisture in your house that would lead to fungus buildup. So you just want to make sure that the air is not really dry, but also not very moist. So just to be the right level that's comfortable for your airways. The other thing is if you're struggling with nose symptoms. So if you had a cold, you may have had a runny nose. Now, those secretions can still run down the back of your throat after the cold is over for another few days or weeks. So if you have a lot of nasal secretions, mucus that's stuck in there, it's a little bit thick, can't get it out, you can sometimes use, besides hydrating yourself well, you can use a little bit of saline solution. You can get this from the pharmacy. Normally you can get these little vials of about 10 milliliters or 5 milliliters of saline fluid that you can just open up. They're sterile. You can put a little bit in your nose, sort of inhale it inside your nose, just let it act for a bit and just your nose, blow out all that mucus so you can breathe easily. And there's not a lot of mucus that doesn't run out of your nose and just runs down the back of your throat, if that makes sense. So that can sometimes help as well, if you want to try. The other thing is acid reflux. So your stomach may be, producing a lot of acid. It's coming up. It's going up and irritating your airways. This normally happens at night when you're lying flat. So you may want to consider watching what you're eating when you go to bed. So try to avoid large meals before going to bed. If possible, have your dinner 2-3 hours before actually going to sleep so that your stomach's empty of all that food content. The other thing is to try to watch whether there's anything in your diet that's causing you to get acid reflux and indigestion. So you may know that better than I would. It could be, something spicy. It could be dairy. It depends from person to person. So try to watch, and try to not eat those things that are actually causing you to have a lot of indigestion and acid reflux, because that can actually irritate your airways as it comes up overnight and make the cough get worse. If you can sleep a bit propped up, so the gravity keeps the actual acid in the stomach, that can also help as well. The other thing is, if you are a smoker, now is a really good time to stop. So one of the best times to actually stop smoking is when you get some sort of a chest infection or a cold, because for maybe a week or so you will not feel like smoking. You'll find it really uncomfortable to smoke. So it helps you beat the addiction to nicotine. So if you can try to stop smoking, that would be fantastic, because the smoke itself is an irritant. So it will make your airways more irritated. It will keep the cough going for longer. And the final thing is, remember to always try to breathe in clean, fresh air as much as you can. So try to ventilate your house as much as you can. Try not to spend the entire winter indoors without opening the windows, without getting fresh air. Even if it's cold, the best thing you can do is just open everything up for 5 minutes, replace all the air in your house, and then close everything. Your house will probably not become very cold if you do that. It's actually worse to just keep a semi-open window for longer. It'll probably make your house be even colder, but really breathing in fresh, clean air is much, much better than being stuck inside with stale air for the entire winter. That's probably not going to help your cough or your health overall. And even if it's cold outside, try to go outside for a bit. Dress up well, use some sort of a scarf, use a hat, even if you've had a cold, and just try to just be outside for a little bit, increasingly more and more. Try to keep walking, get everything moving. That will actually help move all that mucus from your airways and improve your cough overall. So I hope these tips were helpful to you. And really, if you are struggling with a cough that doesn't go away, it's been more than 2 months, please see your doctor, see if there's anything else you need to do. But otherwise, try to implement some of these tips if you find them helpful, and hopefully you'll feel better soon. All the best to you and good health. See you in future videos.